Hi there. I was listening to the Ontario update today, and your counterpart, Dr. Baber Yaffe, saying that they are in a very dire situation. You mentioned that we're about a month behind Ontario. So are we doing enough here to prevent our very dire situation?
Yeah, I think the comment I made about us being a month behind Ontario, that was in relation to the proportion of our cases that were variants of concern. So we're about 60% approximately right now. Ontario is about a month ahead of us, and they're much higher than that. So it was really only in reference to the proportion of variants of concern that we were seeing in our cases every day. We are charting our own pandemic, and we've said that from the very beginning. We've seen that across the country. There are different population dynamics. There are different population demographics. There's different types of transmission events and super spreading events and introductions that are happening in different parts of the province. So Ontario has been hit hard, and they had come down, but not to a low enough level that they were able to support their healthcare system. Obviously, we're watching that really carefully. We're looking at what we need to do here. And we presented our plan for our strategies for supporting our healthcare system back in September, and those plans are still in play. We're monitoring them regularly. We have the metrics that we are using. We also have a very strong network around the province to support where pressure points are happening in the hospital system, and we saw that in the last few months in the north, being able to decant people who needed care out of the north to other places, and recognizing how challenging that is both on families who have a loved one who's sent to Vancouver Island, for example. But yeah, this is something we're paying attention to in a huge way, and why we put in the restrictions that we put in, why we're focusing on the measures that we need to do in communities to prevent transmission, to reduce the risk of people needing hospitalization. So it's all looking at what we have in our networks and our supports and our healthcare system here.
Lisa, do you have a follow-up?
I'm going to try a double barrel here a bit. You mentioned the hospitalizations, and I'm just wondering what happens to hospitals if we keep increasing and we get closer to the couple thousand, 3,000 cases a day. And also, with all of this, does it mean that isolation instructions need to change? Like, I know we've heard from parents and families saying, when a kid is sick or a kid has to isolate, other people are able to continue going to work. Is that too risky now?
And so there's a couple of things around that. I'll answer your second question first. Yeah, we have had a lower tolerance for if somebody in the family is ill, because we're seeing it spread so rapidly in families, in particular in households, that yes, keep the children home from school if somebody's sick. Get tested. Make sure we know what is happening. And the case management contact tracers are doing that. So every situation is a little bit different. It depends on what you do for work, for example, what the risk might be. But yes, it is right now, if somebody in the household is sick, then everybody needs to pay attention and make sure they're getting tested, that we understand the transmission in those environments. So we have a much lower threshold for staying home if somebody's sick in the household right now and not sending children to school. And I've said that a couple of times because of the rapid increase we saw in a lot of social interactions that were happening over the spring break. In terms of hospitals, the models give us a sense of what are the parameters that are most important going forward. It's not a prediction. It's not a prediction that we're going to have 3,000 cases next week. And we've not seen that happen in other models that have presented in the past. It helps us look at what are the things that we need to adjust and where we need to go with those. So, we've put in additional restrictions. People are paying attention, and we are reducing the transmission in our communities. We've seen that a little bit, and we are looking at the hospital plans across the province, and we'll be talking more about that on Monday in some detail.